How common is it for a hormone receptor positive breast cancer to mutate into say a triple negative cancer? Is that very common?
Yeah, good question. It's not as uncommon. I think the published rates are about 10 to 15% of patients with hormone receptor positive at some point may change to triple negative breast cancer. There's a bit of a heterogeneity and ongoing evolution of the breast cancer cells throughout the treatment. So often there's mutations that occur later in the breast cancer that sort of gives cancer resistance to the treatment. And one way that the breast cancer can get resistance, especially when we're blocking all supply of estrogen, is that they just lose their estrogen receptor and find a different way to grow. And that's why sometimes when we see that especially if the cancer, for example, has been fairly indolent and responsive to treatment and all of a sudden starts progressing faster, there's few oncologists that would advocate for doing a re-biopsy to actually check whether that's happened. And especially now with the growing number of these targeted treatments, I didn't go through all the exhaustive list of the targeted treatment that exists, but there's some drugs that work on particular mutations that the cancer can develop later in the course, and can make it then sensitive to a newer generation of targeted drugs. So biopsy is certainly relevant.
That's exactly what my situation is. Hormone positive, use the ribociclib and the other targeted treatments, and then with the biopsy I had just recently on my liver, it's triple negative. So it found a way around it by the looks of things.
That's right. Yeah.
So you described exactly what had happened to me, Vlad, just in recent times.
That's right. And the benefit of having a biopsy now is that it can also show, what type of triple negative it is, because sometimes there might be additional treatments apart from the chemotherapy. It's traditionally, once we confirm triple negative, then we talk about chemotherapy only. And hopefully these couple of drugs that I mentioned in triple negative would be an option as well soon.